following presentation discusses the role of a speech pathologist, the frameworks of practice, why they are important, and how this relates to you as early childhood educators. Speech pathologists are allied health professionals who treat, manage and assess speech and swallowing disorders. They can treat people of all ages and assist people with developmental delays, stroke, learning or intellectual disabilities, cerebral palsy, dementia and/or hearing loss. As early childhood teachers, you may have come across a speech pathologist in your workplace, but they can also provide services at home, schools, private practices, hospitals, and community centres. Speech pathologists can be part of a child's intervention team from an early age. Often, other areas need to be supported first or at the same time to help your child learn to communicate. So, there can be transdisciplinary collaboration between speech pathologists, teachers, audiologists, occupational therapists and nurses to best support children's communication skills. Now, most of you would have heard of the Early Years Learning Framework. This framework plays a critical role in supporting learning for young children and is based on 3 characteristics: belonging, being and becoming. Speech pathologists and early childhood educators can work together to ensure support and development of language learning skills to participate in everyday life and cultivate future communication skills. We will now look at 3 frameworks that are associated with Speech Pathology Australia. The first framework we will look at is the ICF. Speech pathologists are guided by the International Classification of Functioning, Health and Disability, a framework devised by the World Health Organization in 2001. This model can also be called the biopsychosocial model, as it considers health conditions such as diseases and injuries and contextual factors such as individual, environmental and social impacts. So why do we need the ICF? Speech pathologists take a holistic view on practice, and in guidance with the ICF, they look at different aspects that influence a person's capacity to engage in activities. For example, this is Sam. He has a language delay. A speech pathologist will first consider his past medical history, then look at factors such as his general behaviour, peer interaction and his interests. Sam's family are refugees from Iran, so cultural factors and home life are also considered. So they take into consideration not just the language delay, but all these different factors and how it affects his daily activities. The speech pathologist then carries out an assessment using informal and standardised testing to then assist you as the early childhood educator to create sessions based on Sam's communication skills. This could be developing their phonetical literacy skills such as spelling and reading, phonological awareness, or by extending vocabulary verbally or on an AAC device. The scope of practice has been developed in association with Speech Pathology Australia to produce the Code of Ethics and the Competency-Based Occupational Standards or CBOS for entry-level speech pathologists. The next framework we will now look at is CBOS, developed by the Speech Pathology Australia in 2011 and revised in 2017 to include the acknowledgement of Aboriginal and Torres Strait Islanders. CBOS is a document that outlines the skills, knowledge and professional standards required for entry-level speech pathologists. I'll look at the CBOS document in more detail. The 6 main areas of range of practice include language, speech, swallowing, voice, fluency and multimodal communication for adult and paediatric clients. The range of practice principles explain that speech pathologists can demonstrate evidence-based practice, be able to work with various disciplines and be culturally sensitive. Furthermore, it also explains what is not expected, for example, to demonstrate full competence in individual complex needs. Generic competencies are the fundamental capabilities of what is needed as a speech pathologist. And finally, the competency-based occupational standards, which are divided into 7 units. They are assessment, analysis and interpretation, planning evidence-based speech pathology practices, implementation of speech pathology practice, planning, providing and managing speech pathology services, professional and supervisory practice, and lifelong learning and reflective practice. In 2010, the Code of Ethics was developed to assist and support speech pathologists to deliver appropriate practice. The Code of Ethics are a set of standards that explain values and principles to speech pathologists to demonstrate professionally acceptable behaviour and also provides guidelines to identify and report a breach of professional conduct. For more information, please visit the following websites. Thanks for watching.